Hi, I'm Dr. Nick. In this video, I'm going to share with you how I helped a good friend of mine overcome a problem with his great toe that he had suffered with for over 3 months. Let's see how we help Gary get over his toe problem. So my good friend Gary, who grew up in my hometown, approximately 3 hours away in Pennsylvania, called me one day explaining that he had a problem with his great toe that he had been suffering with for over 3 months. He had seen local doctors, he had been to the urgent care, and he was told he had an infection or cellulitis of his great toe and was given an antibiotic. He had in fact been given several antibiotics and the problem did not resolve. When he called me, obviously I asked for a picture. He shared the picture with me and it was the classic presentation of a toe where the toenail becomes chronically ingrown, not bad enough to create a large infection, but just enough that it'll create a circular process where the inflammation from when the nail curves into the side of the toenail, where the adjacent nail folds get inflamed and that subclinical infection occurs. I had also placed him on an antibiotic for 2 more weeks, which did not resolve the problem. At that point in time, I explained, Gary, you need to come out and have your toenail removed. I've seen this happen many times in the office, and typically by removing the toenail temporarily and allowing a new nail to grow in, the problem resolves. What made this an extra special visit was he was traveling 3 hours to see me, so we had to make sure Gary was relaxed and comforted, and we had a lot of fun with him. We like to have fun in our office and treat our patients with a little bit of a sense of humor and make them feel at home and not worried or scared about what we're doing. So in this particular example, he came to visit me after hours, and we had a good friend of mine who's a magician, illusionist, and Guinness Book of World Record holder come in and do some tricks for Gary and his dad before we performed the procedure. And then during the procedure, we had him doing some card tricks, making him feel at home. This obviously isn't something we do every day in the office, nor would I do with our typical patients, but it was a lot of fun to share this entertainment with my friend while we helped his toe problem. So my good friend Rick Smith Jr. came in, performed some tricks, and you can watch that video as well that he has posted on his YouTube channel. If you can click above and see that.
It's been going on since about...
Something probably caused the inflammation. Once the skin gets inflamed, it just creates a cascade of swelling, and the nail pushes into that swelling, and you can't get it on camera.
You do this all the time, Nick?
We've done probably 2 of these today, 2 or 3.
You've done this 3 times today. Same procedure.
Similar. Sometimes it's not the whole toenail. I did a piece earlier.
Why? Because it was an ingrown toenail.
But this
you taking whole toenail off?
The whole toenail. See how that corner was ingrown? Now watch this. This is going to be a big part of that corner come out of there. You all right up there?
Yeah.
How you feeling?
Good.
The important part. We clean all of this out. And that's where all that...
Was there a lot of that, Nick? Huh?
Yeah, I mean, it was inflamed.
Best still going. You're one of a kind.
Nick, but you did that so easy. You know, I messed around with that a little bit. I thought I was going to take it off myself.
Well, like my dad said, when you have the right tools,
yeah,
you can do anything.
Well, those tools are, you just got some pliers. Is it the tools or is it the Novocaine? I would have been able to stay in the pain.
A little bit of everything. You wouldn't be able to undergo the pain without the Novocaine.
How long do I got to keep that bandage
Till
on?
tomorrow. And then you soak it warm water. Soaking.
How's it feel?
I don't feel anything. It's numb.
The good news, it'll feel better when it stops hurting.
You have blue over here. You want blue or green? So the procedure was successful. Gary went back home 3 hours away. He actually drove himself with his dad that evening, and we had a lot of fun doing it, having our good friend Rick Smith Jr. in, doing some magic tricks and illusions. And I can honestly say I have one of the best jobs in the world where I get to come to work every day and treat patients and have fun and help people get over their problems. So thanks again for watching. Make sure to hit the subscribe button below. If you have any questions or comments, please leave them in the comments section below. And check back soon as we'll have more surgical videos and patient pathologies that we see in the office on a daily basis.